right. So I think let's wait for 1 more minute to kind of, since people are still joining. Okay, so let's begin our our department's lecture today. So welcome everyone to our department's guest lecture. Today we are lucky enough to kind of get Dr. Dee Jordan to present her research and her work, the role of environmental racism in amplifying health inequality in minority and undeserved communities. So Dr. Jordan's lecture is also part of the diversity celebration in our College of Arts and Science. So so I will move this to Dr. Kathleen Schroeder. So Dr. Kathleen Schroeder is a friend of Dr. Jordan, so she will give us kind of a brief introduction of Dr. Jordan.
Thank you, Sung. So it is an honor to introduce Dr. Dee Jordan today. She is a postdoctoral fellow at the Harvard Medical School. She's an expert in global health. I got to know Dee about 6 months ago through our mutual friend and colleague, Dr. Kim Elmore, who is a graduate of our program. Kim was Dr. Jordan's mentor at the CDC in Atlanta. And Dee and Kim have had a long, productive relationship. And Kim was nice enough to introduce me to Dee. So Dee has looked at issues of environmental health and issues of environmental justice for about the last 10 years. I was reviewing her CV a couple of days ago, and I texted her to say, Dee, you are one incredibly productive woman. And she kind of laughed and said, well, I've got way too much energy. And I think that's really clear. She's got way too much energy. And lucky for us, she's using that energy to talk about issues of global racial health justice and health disparities. She would be happy, I'm sure, to take questions. I've asked her to save a little time at the end of her talk for questions. And today she's going to talk about 2 case studies she did that looks at racial and environmental justice issues in 2 cities where she's done some research. So we are so lucky to have Dee with us today, and I'm going to turn it over to her.
Thanks, Kathleen. Good afternoon, everyone. Thank you for having me. I'm going to do my best to not bore you to death. And barring any major issues, give you a survey of 2 studies that I conducted on environmental justice and its impacts on health of the communities in the surrounding areas. Can everyone hear me okay? Awesome sauce. Well, let's get started. While we often hear and read about racial discrimination, employment bias, discriminatory housing practices, and other obvious ills of systemic oppression, there is inadequate coverage of an equally destructive form of discrimination, environmental racism. The pollution of soil, air, and water are all environmental injustices that often shorten the life expectancy of residents in minority and underserved communities in the U.S. As a health geographer, I'm interested in place-based health outcomes. Therefore, I start most research inquiries with 3 questions: what, where, and when, which allows me to spatially conceptualize exposure and risk to determine if a trend exists across space and linearly over time, if the phenomena persist or occurs in a single instance, or if it's cyclical, meaning it has ebbs and flows. This particular talk is titled Justice or Just Us: The Role of Environmental Racism in Amplifying Health Inequities in Underserved Communities. The flow of my talk today will be an introduction to the concept of environmental racism, health inequity in underserved communities. Next will be an overview of the Houston, Texas case study characterizing the environment, a discussion of the study's findings and the policy implications. We will then move on to Atlanta, Georgia, and discuss the background of that case study, the purpose of the study, and the outcomes. And then finally, we will conclude with my remarks on environmental racism and I'll acknowledgments, and I'll answer your questions. So let's get started. Welcome to Mountaineer Airline. We have a lot of geography to cover today, so we might as well do it in style. Flight attendants, please prepare the cabin for departure. Our first stop is Houston, Texas.
Ladies and gentlemen, welcome to Sabang Airport. We have landed in Sky Park Terminal. We have certainly enjoyed having you on board today. Hope to see you again soon. Thank you again for flying with us. Have a nice day.
And now that we're all duly welcomed, let's talk about what's happening in the city of Houston and the areas surrounding the Houston Ship Channel. This study is called Unbreathable, and it's a study of cancer risk and premature mortality along the Houston Ship Channel. Environmental factors within communities play a significant role on the health and well-being of residents. Physical determinants, such as exposure to environmental pollution, toxic substances, and other physical hazards, have a substantial effect on the health via the interplay of humans and the built environment. This intersection can result in negative health outcomes for residents. Health inequities among minorities and underserved communities are amplified by the onset of policies and practices such as locally unwanted land uses underpinned by environmental racism. These realities form the backdrop for many residents in fence-line communities across the U.S. A fence-line community is a neighborhood that is immediately adjacent to a company and is directly affected by noise, odors, chemical emissions, traffic, parking, and operations of the company. This first study looks at an area around Houston, Texas, just about 8 miles outside of Houston, and several other communities that circle or are fence line to the Houston Ship Channel. In this talk today, we're going to spotlight one of the communities, Galena Park. The Houston study area will focus on place, health, environmental justice, and how spatial segregation, built environment factors, and the stress of poor living conditions contribute to cancer risk for these communities. In this study, I was particularly concerned with the time period between 1990 and 2010, which bookends the period when state and federal environmental regulations had been laxed and largely unregulated. Galena Park is a predominantly minority community of African American and Latinx residents located along the Houston Ship Channel and the Port of Houston Petro Refining Complex. The community is about 8 miles outside the city of Houston in Harris County, Texas. The residents of Galena Park have faced historically undocumented environmental and urban health concerns. The community is a medically underserved area, and many of the residents do not receive primary care. It is an economically challenged community, and approximately 20% of the residents live below the federal poverty level. Latinx residents make up 75% of the population in Galena Park, and there is a high rate of linguistic isolation. Many residents don't own cars, and public transportation in the area is virtually non-existent. The community shares its landscape with the dredge dump site to the north, petroleum refineries, chemical manufacturers, grain plants, and the shipping channel all flank the south and the east of the community. The community has interstates to the west, and the entire neighborhood is encased by railroad tracks with trains running multiple times of the day and night. The aerial image also shows the community's proximity to industrial sources of environmental toxins. Of particular concern to the residents of Galena Park is the presence of benzene, which is a group 1A known human carcinogen. The community is also residentially segregated. This image reveals the residential settlement pattern, some of which is inherited from past housing segregation policies, and the rest is by choice. The Black residents occupy the western part of the town in what is historically known as Galena Manor. White residents are in the middle, and the Latinx community occupies the eastern parts of town. The Black and white communities in Galena Park have been historically segregated by the train depot, staging area, and multiple train tracks. These structures acted as lines of demarcation when race-based residential segregation was a top-down policy in the US. During visits to the community, it became evident that they were also socially segregated. And this type of segregation limits social capital in the community, and it proves challenging when attempting to bring all the parties to the decision-making table to improve the environment. Researchers also suggest that segregated communities often have concentrated area-level poverty. Area-level poverty means the community is resource poor. Therefore, social and material supports are crucial in order to protect the health of the residents, improve their quality of life, and decrease negative health outcomes. The determinants of health are the driving factors in one's community and surroundings that have either a positive or negative impact on a person's health and well-being. These determinants can be fundamental, intermediate, or proximate, all of which have an influence on the population health. For this study, the determinants are race-based residential segregation, which is a fundamental predictor of health disparities, or the difference in health outcomes between distinct groups, which stems from the lack of health equity. The intermediate determinants are industrial pollutants and locally unwanted land uses, such as waste dump sites and industries surrounding the community, which reinforce the notion that health inequities are the results of more than individual choice or random occurrence. They are the result of poverty, structural inequity, discrimination, and intentional systems of oppression, such as environmental racism, and they amplify poor health due to the presence of pollution and environmental toxicants across the landscape of adjacent communities. Community infrastructure and the social environment also act as intermediate determinants of health and they are heavily influenced by segregated neighborhoods. The proximate determinants are environmental stressors and neighborhood conditions, those things that pose a barrier to a healthy lifestyle and healing. For instance, the lack of sleep from noise from the trains that surround the community creates a disruption in the sleep-wake cycle, and sleep is when the body rebuilds and fights off free radical formations, which cause cancer. The study was bound to 10 zip codes that represent communities around the Houston shipping channel. The population of those areas are approximately 316,000 residents, and it represents about 16% of the population inside the Beltway, which is an 88-mile interstate highway that surrounds the city of Houston. Economically, the study areas average median income trails behind that of the US as well as the state of Texas, and it's about 10,000 more than the federal poverty level. The percent of poverty in the area is around 20%. The US defines high poverty areas as census tracts, which with 20 to 29% of the population falling below the federal poverty level. The population demographics reveal that race-based residential segregation is widespread among minority residents and that they are isolated from their white peers. This creates additional concerns surrounding the ability to generate social capital to collectively address community concerns, and it may result in reduced compliance with public health messages from excess linguistic isolation, especially among segregated Latinx communities. In 2008, the Texas Commission on Environmental Quality compared the levels of benzene across the nation and listed the areas with the highest levels. Of all the cities in the US, several were from the study area, and Galena Park had the highest rate. Benzene continues to exist in high levels in the area and poses a concern to the communities in Texas to date. There are 84 chemical companies surrounding this 5 square mile community. The soil in the dredge dumping site tested positive for high levels of DDT, PBTs, lead, cadmium, and other heavy metals. Those heavy metals can leach to other areas during severe rain events. The dredge dump facility is less than 200 feet from a Little League sports complex. The presence of environmental pollutants and ambient air toxins like benzene that persist in the environment and bioaccumulate in the fat cells of humans is of significant concern to fence-line communities. In addition to the chemical plants, there are 185 hazardous waste facilities in the study area, most of which have the presence of 1,3-butadiene. 1,3-butadiene is a chemical made from the processing of petroleum. Acute exposure to the toxin can cause serious damage to the central nervous system, while long-term exposure and occupational exposures have been associated with the increased incidence of leukemia. Many of the facilities in the study area have been on the Texas Commission of Environmental Quality's watch list and the CDC's Emergency Events Surveillance list. And for more than 30 years, Harris County, Texas has been ranked #1 for accidental spills of hazardous substances that pose an imminent threat to human life. Over the past decade, several sites along the Houston Ship Channel have been recommended for full remediation or active cleanup. Every location was near fence-line communities. 4 of the 10 zip codes in the study area have the highest levels of 1,3-butadiene that exceed the EPA's acceptable exposure limit. And 5 of the 10 zip codes have ambient concentrations of benzene that also exceed those same measures. And in some instances, zip codes replicate. For instance, 77017 and 77547 are in both groups, as well as 77012. So the exposures are concentrated and coming from multiple pathways. During the time period between 1990 and 2005, approximately 90,000 people in the study area died under the age of 75, which is considered premature mortality. Among those deaths, minoritized groups had the greatest burden and the Latinx community with the highest levels. Now we will look at the deaths over space and time on some maps. This map shows the premature cancer deaths by census tract for the period from 1990 to 1994. The population of Harris County for that time period for the study area was around 338,000, and the deaths were around 14,000, so generally 24%. The black globes represent the premature deaths and seem well distributed throughout the study area, with the highest numbers near the shipping channel itself. Now, looking at the same measures for a different period from 2005 to 2010, the burden of deaths shift to a community south and downwind of the shipping channel. Now let's look at those deaths while overlaying some of the determinants and the exposures onto the landscape. I want to caution you, they're congested. The maps are a bit noisy because that's the reality of the ground. And in order to see it, we have to map it. So first, let's look at poverty. When we look at premature mortality against the poverty variable in green, from 1990 to 1994, 18 of the census tracts within the study area are in the extreme poverty category, with 40 to 66% of the population living below the federal poverty level. 8 of the tracts are in the extreme poverty category and are in the high premature death category during the same time period. This is indicated by the darkest green shading that shows the extreme poverty and the largest black globes, which show the highest premature deaths. During the 2005 to 2010 period, premature mortality is concentrated southwest of the Houston Ship Channel and sustained in the study area. Now we're going to look at the hazardous waste overlaid onto the landscape, as well as the 1,3-butadiene concentrations. Again, caution, the maps are a bit noisy because they are peppered with all the industry and exposures, but this is the reality of the people who live on the ground. During the 1990 to 1994 period, there are 3 zip codes in the study area higher than the acceptable limit of 1,3-butadiene, and those are indicated by the darkest brown shading. Those zip codes also have a lot of hazardous waste sites and premature deaths for that time period. So you can start seeing a pattern here. We looked at it from the poverty angle, and now we're looking at what else is in this environment that's contributing or could possibly contribute to the deaths that we're seeing. And you can start mapping the globe placements, the largest ones, where they are in context to what else is around them, and begin to tell a story. In the 2005 to 2010 period, the burden of deaths are downwind from the shipping channel once again, but still in close proximity to clusters of hazardous waste sites. And the hazardous waste sites are indicated by this orange and black triangle. I tried to go with a color that was very dramatic. Now we want to look at benzene exposure, which of course was the community's concern. The others were just add-ons. They didn't know that those were concerns. This was the one they were concerned about. Looking at benzene, there are 3 zip codes with the highest level of benzene, denoted by the dark purple shading, which of course includes Galena Park as previously indicated, and the clusters around them of the chemical companies within those same zip code boundaries. The chemical companies are designated by the shield the diamond type shield for the chemical industries. In this image, more than the others, the higher depth numbers seem to tightly align with the location of the chemical companies. When we look at it from 2005 to 2010, in that time period, while the death burden reduces slightly, there are still high levels in the communities near the shipping channel. So the picture is starting to be made clear here. Around the shipping channel, we're seeing a higher burden, and that's likely due to the exposures and the what's being put into the environment from the operation of the shipping channel and the petro refining complex. So what did we find? There were 4 major geographic areas that have the highest number of premature cancer deaths across the study area from 1990 to 2004. They contained about 36% of the premature cancer mortality inside the Beltway. They were all in medically underserved areas. And medically underserved areas are designated by HRSA as having too few primary care providers, a high burden of infant mortality, high poverty, and a high population of the elderly. So these would be considered vulnerable communities. Further, we found that from 2005 to 2010, an area on the south side of Houston increased in the number of premature deaths, while all other areas saw downward trends. This was particularly concerning to us because it might be explained by the downwind effect. This area includes the community of Sunnyside, which is a segregated Latinx neighborhood. This area is a low-income community with no access to care. And it has a high mortality and it's medically underserved. So we have poverty. Once again, these themes keep coming up: poverty, segregation, language isolation, medically underserved, and then we have high burdens of death. So the story starts to come together a little bit. So what were the potential policy solutions when you're looking at environmental justice and racism, and you need to start thinking about what can be done to remediate? How can we try to solve this problem? So I gave it a go. Develop an urban planning strategy that will create environmental carcinogen buffered or safe zones around schools and residential areas. As I said, the dredge dump facility is 200 feet from a Little League sports complex. Leaching can occur very easily because they're in such close proximity. If there is a high rain event or flooding event, that could pose a health hazard because the metals can leach into the ground and cause some additional health effects for the children. They can create benzene abatement programs. There are certain trees that like benzene. Line the streets with them and allow those trees to do what they naturally do to absorb some of the benzene out of the atmosphere. Create policy regulations and enforcement on hazardous waste cleanup and remediation to reduce human exposure risk to industrial pollutions. For America to know, for our agencies to know that for more than 30 years, Harris County, Texas has been on the national priorities list for the accidental spills of toxic substances that pose an imminent threat to human life, that we know this, and we've yet to do something. That's willful ignorance. We willful neglect. We willingly choose to ignore it. And you have to ask yourself, what's driving that? create social service collaborative community resources. These communities are resource poor, largely linguistically isolated, so we need more social and material supports to help increase their health and well-being so that they can also thrive. And we need to expand transportation options. We have a high carless population, so that tells me that people aren't getting in and out of their own environment. So this is what you're breathing. And if the air you're breathing is unbreathable, but it's the only air you can breathe, then we're creating a self-reinforced system of health equity, health disparities, and premature death. Since the study was funded by grant, I want to take the time to acknowledge that National Cancer Institute grant that helped me conduct this research during that time. And now we head back to our nice jet in the Mountaineer Airline, and we board our fancy jet. Flight attendants are going to prepare the cabin. And Houston, we have liftoff. Next stop, Atlanta, Georgia. Now I will present the research project entitled Soiled Souls, exploring premature mortality in communities near urban brownfields inside the perimeter of Atlanta, which provides a lens into soil pollution and its potential hazards to human health. So when I think of Atlanta, the first images conjured are warm, sunny days, traffic jams, the Braves, skyscrapers, and a bustling central city economy. At first glance, Atlanta looks much like other urban centers in the US. However, a closer look provides a window into the past rail town that was once Atlanta, Georgia. The remnants of the 1830s industrialization still exist today. However, not in the form of preservation pieces at the museum, but as environmental artifacts from rail yards, metalworks, tanneries, and other abandoned sites, all which have left an undeniable footprint on the city and health effects in the community. In this project, we sought to characterize the spatial distribution of premature mortality from certain cancers and chronic diseases inside the perimeter of Atlanta, with the potential association to environmental contaminants often found in brownfields, and to determine if living near brownfield sites influence the occurrence of premature mortality. So what are brownfields? According to the Environmental Protection Agency, brownfields are abandoned, idled, or unused industrial and commercial facilities where the presence or potential presence of hazardous substance, pollutants, or environmental contaminants complicate expansion or redevelopment. Historic uses of these properties include industrial properties, old gas stations, vacant warehouses, former dry cleaning establishments, and sites that contained petroleum products. While they are not as toxic as Superfund sites, these locations still pose considerable health risk to the people who reside near them. In 2002, Jill Litt and Thomas Burke explored links between brownfield exposure and health outcomes in Baltimore and found some concerning results. It has been 19 years since that study was conducted, and while there's so much to learn from the effect of brownfields and human engagement with the spaces near them, there has been very little momentum towards such investigations. In the city of Atlanta, the Georgia Environmental Protection Division reported nearly 600 brownfields in the metro area as of 2017, which raises exposure concerns for residents and a compelling reason to investigate health outcomes in the city. The redevelopment of brownfields is increasing due to EPA funding earmarked for renewal and the reimagining of these spaces. Projects include green space developments and blue space developments. Parks, walking trails, and parking lots are the most common brownfield development projects that occur in the city of Atlanta. Pictured in this image is D.H. Stanton Park, one of the premier brownfield redevelopment projects in the city of Atlanta. It's a beautiful, carefree place for children and families in the historic 4th Ward area of Atlanta. D.H. Stanton Park is located inside the perimeter and was formerly a large urban landfill site. In 1999, a methane gas incident resulted in the severe burning of an African American second-grade girl while she was playing on the slide. The injury was sparked by the friction from the static electricity buildup while she was sliding down the slide and unremediated methane gas seeping through the soil from underground landfill. The park was immediately closed and full remediation occurred, and the park was reopened in 2005. Beyond soil vapor intrusion, the toxins seeping from the ground, and the fire hazards, brownfields could also be contaminated with detergents and industrial solvents, volatile organic compounds, heavy metals, polycyclic or aromatic hydrocarbons, plasticizers, insecticides, and other chemicals that persist in the environment and bioaccumulate and are known to cause negative health conditions in humans. Most vulnerable are those people in the surrounding communities, such as those who live near D.H. Stanton Park in the area image here. So the purpose of this study was to characterize the spatial distribution of premature mortality among those 19 to 64 years from certain cancers and chronic diseases and all who lived inside the perimeter. We wanted to examine the relationship between living in close proximity to one or more brownfields and the premature mortality inside the perimeter as a whole. Premature mortality are the years of potential life loss, defined as the average years a person would have lived had they not died prematurely, and it's based on the national life expectancy. We chose the ICP, as we call it in Atlanta, inside the perimeter as the study area because the city of Atlanta's municipal and political boundary is confined to specific areas near the central business district. However, the true metropolitan area includes parts of the 5 core counties, Fulton, DeKalb, Cobb, Gwinnett, and Clayton, and extends to I-285, which circles the city, much like the Beltway of Houston. The health indicator of observation is premature mortality, and for this study, we defined it as deaths that occurred in those 19 to 65 years of age. The years of observation were 2010 to 2013. The scale of observation for this study is a zip code tabulation area. Although not a true aerial unit for geographers, they can serve as a proxy for communities in some analyses in which population data from the U.S. Census is available. Within the Atlanta perimeter, many ZICTAs are smaller in area than a census tract, which provides better granularity for observations in this study. Zip codes are also highly recognizable and have proven to be more accessible for the creation of maps that are provided to community members, politicians, and decision makers. We used Georgia Vital Records death data, but excluded deaths from injuries and trauma or diseases with genetic origins, alcohol, cirrhosis, infectious diseases such as HIV, tuberculosis, and meningitis. We excluded sickle cell disease, lupus, and other neurological disorders such as epilepsy and seizures. And we also excluded diseases of unknown origins. Why? Because we wanted to restrict our cohort to chronic diseases and cancers with a known association to environmental exposure. The YPLL, or years potential life loss, was calculated using the life expectancy for men and women minus the age at death, and we summed that to the zip code. Although we were focused on brownfields, we included Superfunds and toxic release inventory sites because of their potential environmental exposure. And we also created a buffer zone around the perimeter to account for edge effects to ensure that we were capturing the population entirely. We used a ordinary least squares linear regression model to estimate the effect of the number of brownfields in the ZICTAs on the years of potential life loss, and we controlled for the age and poverty level. We also used a geographic rated regression is a similar model, but takes into consideration the spatial variation in the dependent variables. For us, it meant that how near or far each occurrence is from another, each incident, each death is from one another in comparison to the location of the brownfields. And all of that is especially important in spatial analysis. It also weights the model by the number of instances a zip code is associated with death. Lastly, the cluster detection method was used to determine if the residuals from the model are clustered, which would indicate areas with unexplained premature mortality, meaning YPLL could not be explained by either brownfields or poverty. We found that premature cancer mortality was around 77%, accounted for about 77% of all the deaths in the area, compared to 26% of all deaths in the US. We also found that a premature cancer-specific death rate of 150 per 100,000 people compared to 102 per 100,000 in the US. So these numbers are greater in this area than for the entire nation. Additionally, the total years of potential life loss for this study area was 71,676 years. It's a lot of things people could do with that time. Additionally, we found that 80% of the premature mortality occurred in specific age groups, 44 to 64. Blacks accounted for 61% of that premature mortality, and females accounted for 50% of the deaths by gender. There were 5 ZICTAs with the highest premature deaths. The total years of life loss for those 5 ZICTAs was around 15,000 and represented 21% of the premature deaths in the entire study area. The top 5 ZICTAs were all in Fulton County. So this map shows poverty in the study area. Lightly shaded areas had very low poverty, and darker shaded areas have very high poverty. The highest rates of poverty are in the West Central Corridor, Southwest, and Southeast sides of the city. In the city of Atlanta, high levels of poverty are often an indicator of densely populated, residentially segregated areas. While race-based residential segregation was historically a top-down strategy in Atlanta, which included moving Interstate I-20 to create a line of demarcation between the white North and the Black South of town, this is now the preferred settlement pattern throughout much of the city today. If you notice, the hospitals are on the north side of town, where the most wealth or the least amount of poverty are located. I want you to keep that in mind for the additional maps that we're going to look at. The top 5 zip codes for premature death are also in some of the most impoverished zip codes in this study area. Generalized poverty are areas where 20% of the population lives below the federal poverty level. Concentrated poverty is defined as 25 to 39% of the community falling below FPL, while extreme poverty is defined as more than 40% of the community below FPL. 3 of the top 5 zip codes for premature deaths are in concentrated or extreme concentrated poverty zip codes. Zip code 30315 had the highest level of extreme poverty, and 44% of its population lived below FPL. In zip code 30318, it had the highest number of environmental contaminating sites in its zip code. And as previously discussed, concentrated and extreme poverty are indicators of residential segregation, and residential segregation is a fundamental determinant of health disparities. I hope the picture is starting to become clearer. Now let's look at another map. Remember, I asked you to remember the placement of the hospitals previously. The Black Death Density map shows the areas with the highest concentration of premature mortality among African Americans. They are concentrated in the west, southwest, and southeast parts of the city. Now remember the location of the hospitals? They were on the north side. However, the burden of premature mortality is pervasive on the south side. I call that a spatial mismatch, because the health needs and access to care or material support outlets are not in a spatial alignment where the need is the greatest. This mismatch perpetuates and reinforces health desperate conditions. The years of potential life lost map shows the areas with the highest number of life years lost for the study. The YPLL will be greatest in areas where premature mortality is furthest away from age 65, meaning younger people, as indicated by the red areas. So younger people are dying prematurely in these areas, and they have the greatest burden. There was a significant variation in YPLL as indicated by the drop in AIC from the ordinary least squares to the geographic weighted regression model, which reinforces the need to use a geographically weighted regression model to understand what we're seeing in exposure risk and deaths for this study. When adjusting for the entire west central and southeast area of Atlanta became the most significant locations of potential life loss, indicated by the red shadings. An examination of the residuals in the inset map shows a relatively random distribution, demonstrating that the independent variables did a good job explaining premature mortality in this study. In conclusion, there is spatial variation in the YPLL and the location of brownfields across the study area of Atlanta. YPLLs are concentrated in areas where the least amount of access to care exists. The highest burden of premature mortality was among Blacks in the high poverty and high brownfield presence zip codes. So my final thoughts on the matter. Environmental racism is the invisible hand of systemic oppression that manifests in environmental policies on the ground that seek to uplift some groups and harm others. The human health effects from living in communities near environmental pollution, toxic substances, and suffering long-term exposure can be told in the premature mortality of its residents. Policies that allow the siting of industrial complexes in minority and underserved communities is a tactic spurred by low land values, the lack of deed restrictions, and serves as a reminder that the poor are vulnerable to insults, injuries, and assaults of all kinds. Finally, I ask you to ask yourself, is it just or is it happening to some of us? I want to thank my big sister and Appalachian State alum, Dr. Kimberly Elmore, for introducing me to her dear friend, now my friend, Dr. Kathleen Schroeder. Thank you.
So anyone, just if you have any question, just kind of raise your hand or just kind of turn on your speaker and then ask Dr. Jordan about your kind of question.
Oh Lord, I've scared everyone.
Yeah, I actually have a question. So Dr. Jordan, did you, so I just saw that your work is about kind of premature death and the kind of relationship between the premature death and the kind of environmental, this kind of factors. So did you ever kind of explore the kind of another kind of specific disease and then the relation between the kind of not only kind of the death?
Let me see if I have this right. So for me, premature, I like to look at warning signals, early signals of surveillance, such as you would think about tornado warning systems. How can you figure out something is happening and then try to stop it, right? So I look at premature mortality as a signal. You can tell a population's health by the number of people who are dying before they reach the life expectancy. And in most cases, at least with these environmental exposure studies that I've done, I've found that to be true. They trail each other. They tend to trail each other. As far as looking at it with other diseases, I have not studied if premature mortality, say, is the same for chronic illnesses, say like the neurological disorders, the ones that I excluded from the studies because they don't have an environmental component. So I didn't really look at whether or not premature death would be equal, if that would, if that would be a higher burden, because I wouldn't quite see a connection to environment or policies that create that condition. And these were all very, they were very targeted at the policies, these systemic practices that create the types of things that we see on the ground and impact the lived experience of residents in fence-line communities.
Thank you.
Kathleen?
So thank you for that talk, Dee. I know we don't really have good data yet where we can start mapping COVID deaths, but what are you gonna,
Yeah.
I think you already know what you're gonna start seeing. So do you mind speculating just a little bit?
So it's funny you bring up COVID because that's actually the project that I'm working on with the Global Health and Social Medicine Department at Harvard Medical School. I'm going to attempt to build an early system of surveillance using death data as an indicator of things happening, and upticks in deaths might lend way to we need to be watching some new pandemic or some new epidemic is forming somewhere. For me, I will say this, when I look at this from the environmental justice, environmental racism lens, the health inequity lens, when we start to map these things out, these burdens of deaths will be real clear. It is unlikely to happen at large scales in suburban areas or areas where there is more wealth distributed. You will see, however, in areas again where this spatial mismatch happens in these densely populated, poor, segregated communities that have the least amount of access to health care or health options, you will see that the burden is higher amongst those. And that goes to address well, why was it happening to so many African Americans, Hispanic Americans, and the Black and Brown communities? Well, you can answer that question quite easily by saying if they are in these residentially segregated, low resourced areas, if there's a large rate of linguistic isolation, public health messages might not get to them. They're less likely to comply with the messages for fear of stigma from everything, because we have not done a good job in the US of making everyone feel welcomed all the time. And so you get these desperate situations because, I was raised by my grandmother, who told me, if you can't trust the messenger, don't trust the message. So you might be warning me and you might be right, but I can't really trust you because you've not had a history of being empathetic to my community. Why would I trust you now? And in such, I think we see that play across the landscape and all the time. I mean, COVID is just the biggest thing that we can look at to see it, and it's exacerbated. I mean, it's quite clear where the burdens have been, quite clear where they've been.
Thank you.
Any other question?
So, well, I will say, there are no questions. I'll talk a little bit about North Carolina, since that's where Appalachian State is. North Carolina also has some environmental racism issues, particularly with the agricultural entities and the exposures that historical residents, these are people whose families, generational families, have lived in these areas, but the land value was low because they were typically minorities or rural people who had very little money, social capital, or political capital, right? So industry could come in and purchase the land and start these big ag operations, and those have burdens on the communities that are surrounding them, from the exposure, the fumes from the things that they do with the hogs, to the dust that's kicked up at the grain operation places. And when a grain elevator explodes, those particles are released near, far and wide, and they go around to those communities. And even with your windows closed, some particles can still get inside, and you end up having people with inhalation health issues. You have people with reactive airways, eye irritations. You also have some neurological effects because of the insecticides and the things that they're putting into the ground, and kids go out and play in their kids. And at some point, somebody will do an association somewhere between the cases of ADD and ADHD and those environmental factors. And they might find that there is some type of connection, some type of linkages to those exposures. But yeah, North Carolina is not off the, North Carolina has some ways to go with this. But I think part of the problem is also people don't want to call the thing the thing. People like to dance around it and say things like, oh, industry, or big ag, or no, it's environmental racism. And we should say it. We should call it that. Because once you name it and once you say it, you give license to people to actually address it from that frame, as opposed to, well, I mean, I don't want to stop industrial growth, or I don't want to. We cannot continue to sympathize with things that are costing people their lives. And it will affect, we will see this later on in our population pyramids. These things will play out in such a way that we will have an inverted pyramid because we didn't do enough to protect those as we grow. We will see these things. And geography, I mean, I feel well situated being a health geographer because geography helps explain lots of it. But we have to name these things. And we can't make them pretty when the harsh reality is they're quite ugly. So I'm off my soapbox.
So, so if there is no more additional question, then let's ask if Dr. Jordan another big applause for her very wonderful and very interesting work in the lecture. Thank you, Jordan.
Yes,
Jordan.
for sure. Thank you guys for having me. I appreciate it so very much. Take great care, guys.